The fentanyl crisis in this country is causing what some officials are calling a tidal wave of deaths of American teens. Hundreds so far this year have died from drug overdoses, some on school campuses. And tonight, there is an urgent campaign underway to get more schools stocked with that life-saving drug naloxone, newly approved by the FDA, over-the-counter, and already a game changer in some districts. Our Devin Dwyer reports from Austin, Texas, for tonight's Prime Focus.
So this is our clinic.
Nurse Dawn Baker's high school clinic is fully stocked to treat cuts and bruises, headaches, even pregnancies.
So where do you keep the Narcan?
Narcan is up in the corner, up on my little shoe carrier.
And now by the door, next to the epinephrine, a standard supply of the overdose drug Narcan, or naloxone. Easy to grab if she needs to save a life in an instant.
I have 5 doses because one of the doses we used for the overdose.
Just 2 weeks after the school began stocking Narcan last year, Nurse Baker was called to a classroom where a 16-year-old girl was unresponsive.
I walked in there and they were in the process of going from chair to floor with the student.
What was the tip-off to you to know that you needed to use naloxone?
The student checked all the boxes of if there's an overdose.
And you'd been trained, does it just automatically kick in for you?
It is automatic. You administer it nasally. You look at your clock, you know, you have an idea of how much time you have before you have to administer the second one if you don't get a response, and you get ready to start CPR.
Would she have survived if you didn't have naloxone?
I don't think so.
Hays County Public Schools, just outside Austin, has used Narcan 6 times since they began to stock the opioid-reversing drug in schools. 5 students have died off campus in the past year. The drug-related deaths have so alarmed officials that they've produced videos of grieving parents to show students.
He would have been a senior this year. He looked like he was asleep.
The faces of the dead also appear on a billboard nearby.
We are being impacted hard. I think what we're doing differently is we are hitting it head on.
Jerry Scrocky oversees security for Hays County's 26 school campuses with 22,000 students. Last year, one high school student overdosed in the parking lot of an elementary school. Surveillance video captured the passenger pulling his non-responsive companion from the car and performing CPR until medics arrived. Scrocky says images like these need to be seen by students and families.
Our goal was transparency and really making sure that we were communicating that this is out here, and we wanted them to see those faces.
Do you think it's having an impact?
I really do believe it is having an impact.
According to the CDC, illicit drug use among teens nationwide has been on the decline, but overdose deaths, some of them on school property, have been soaring.
We're seeing a significant number of kids getting access to highly lethal drugs that are ultimately leading to an increase in deaths.
Between 2010 and 2019, around 500 U.S. teenagers died each year from a drug overdose, according to government data. But in 2020, the number nearly doubled, 954 deaths. And in 2021, more than 1,100.
And fentanyl is the big part of the problem, right? How much fentanyl is lethal?
The issue with fentanyl is that even in a very small quantity, 1/10 of a grain of rice can lead to an overdose death. And we know that there's plenty of fentanyl on the market that is tainting products that people really otherwise wouldn't know is in there.
The trend has alarmed the National Association of School Nurses, which now encourages schools to stock up on naloxone. According to the Legislative Analysis and Public Policy Association, 30 states expressly authorize the possession and use of naloxone in K-12 schools, but only one state, Rhode Island, requires all schools to keep it on hand.
I'm seeing more receptiveness.
Kate King is president-elect of the National Association of School Nurses.
Why don't more schools have naloxone on hand, do you think?
Fear. The fears that drug users will camp out on the doorstep so that when they use opioids, school personnel will have to run out and save them with naloxone. There's the fear of danger after administration. People are going to come up swinging, and you're going to be in danger. So schools already have emergency preparedness plans. We prepare for tornadoes. We prepare for chemical exposures. This health emergency is no different.
Narcan, English, Spanish.
This substance has been used to create counterfeit medications.
A growing number of school districts are trying to fight naloxone stigma head-on. In Montgomery County, Maryland, students and parents lined up on a recent Saturday to get free doses.
It's very similar if you've ever used a nasal spray like
and to learn how to administer the potentially life-saving drug.
All right, and now press the red button. Perfect.
It's becoming way closer to home. My high school, there is a more use of casual drugs like marijuana and things, and I feel like that could also be potentially dangerous to introduce harder drugs.
Parents like Earl Stoddard say the dangers need to be talked about openly.
It's just important to educate and be aware of what's going on in your community. She's going to high school next year. I know that she's going to be exposed to a lot more, and so I want to have her be prepared for that before she gets there.
We've had actually personal talks at home about drugs. He's like, if you see someone and they're like, oh, here's an Adderall pill, no, it may not just be Adderall.
It's a conversation being had across the country at a PTA meeting in Arlington, Virginia.
As a medical professional, I think it's really important that if we're teaching our kids how to put condoms on bananas, that we can teach them how to put Narcan up somebody's nose.
To Los Angeles, where after 15-year-old Melanie Ramos was found dead in a school bathroom from an apparent fentanyl overdose, the nation's second largest school district is putting naloxone in every K-12 school.
Does stocking naloxone essentially mean we've lost the battle to keep schools drug-free?
No. Schools have had drugs in them forever. It's just that the drug is so much stronger and so much scarier, and, the outcome is death.
A call to stock schools with a life-saving and now over-the-counter drug, and fund the training and education to end stigma.
It's not the answer to all, but it's definitely going to help.
It could save a life.
Yes, absolutely. Absolutely.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.